It is just a huge honor today to be podcast interviewing two MDs in the Ahwatukee community, Dr. David Stone, Dr. Jonathan Komar. Thank you so much for coming on the show today. Your resumes are 14 and a half miles long. I'll try to go through them fast. Dr. Stone right here is a board-certified physical medicine and rehabilitation doctor specializing in sports medicine, interventional spine procedures, and general pain management. He graduated from medical school at the University of Virginia in 2009, where he was honored as the Bowman Scholar, given to the top medical student during clinical rotations, voted on by school faculty and attending physicians. After completion of his intern medical year, he moved to Denver, Colorado, where he completed his residency training in physical medicine and rehabilitation. After his time in Colorado, he moved once again to Arizona in the summer of 2013 to train under the supervision and physicians at Southwest Spine and Sports for a one-year fellowship position. He joined the group at Arizona Spine Disc and Sport in September 2014 as the medical director for the facility. During his undergraduate years at the University of Virginia, Dr. Stone was a four-year starter for the varsity baseball team. UVA was 2014 College World Series runner-up. He still owns multiple career records at UVA, including most games played at second all-time, at-bats fourth all-time, runs scored sixth all-time, hits second all-time, stolen bases first all-time, and walks first all-time. That is amazing. He was drafted in 2002 to Major League Baseball by the San Francisco Giants. His professional career was cut short by a series of arm injuries from which he was unable to successfully rehab. Due to repeated injury, he decided to retire from his baseball career and started the process of applying to medical school. Dr. Stone's mission in the office is to help his patients restore function and reduce pain through the most conservative means possible, and he is excited to work with an excellent medical team of chiropractors, massage therapists, and physical therapists who all have similar goals to him. And note for the record, at my university, I was the number one water boy of all time.
Also very honorable.
That was a great movie, wasn't it, Waterboy? Who was in that?
Adam Sandler.
Adam Sandler. My far left, two down, Dr. Jonathan Komar is board certified in both physical medicine and rehabilitation as well as pain medicine. Dr. Jonathan Komar received his medical degree at Wayne State University in Detroit, Michigan. He then completed the residency program in physical medicine and rehabilitation at the University of Washington, one of the top programs in the nation for his specialty. He successfully completed a fellowship program at Southwest Spine and Sports in Scottsdale, Arizona. This extra level of training as a Scottsdale doctor helped him to gain skill and expertise in state-of-the-art non-surgical care for spine and musculoskeletal conditions. Specializing in men's care, he is a go-go doctor for the weekend warriors. Inundated by the busy work week schedule, men often use the weekends to pursue high-impact and physically demanding outdoor sports activities. However, when injuries occur, this can start a negative domino effect, leading to a decline in function. This can be the cause of missed opportunities, not only on the golf course, mountain biking courts, but in home and work and life as well. Dr. Komar admits that his rehabilitation approach is to treat the whole person, which includes optimizing physical, nutritional, and mental health. Psychologically, men and women are different patients, and men are prone to some injuries more than women. Additionally, in the area of men's health, there is no one-size-fits-all approach to treatment, and this is why personalized care for each patient is an essential part of his approach. As a physiatrist, Dr. Komar's goal is to help improve your level of functioning, reduce pain, and get you back to doing what you love to do. Over the past 13 years, he has developed and perfected his skills by taking a multifaceted approach to patient care. Treating musculoskeletal conditions requires incorporative effective improvement tactics as well as more modern state-of-the-art medicine and a multidisciplinary approach. Dr. Komar also has great passion for regenerative medicine, particularly because he has personally witnessed the success of this kind of treatment on many of his own patients for a variety of musculoskeletal conditions. Over the past 7 years, he has performed hundreds of platelet-rich plasma injections long before it became a worldwide trend. Also, as a clinical instructor for the fellowship program at Southwest Spine and Sports, he provides hands-on instrumentation to numerous physicians in the training program. Dr. Komar's other areas of expertise include spinal injections of the cervical, thoracic, and lumbar regions using X-ray guidance. He has also performed tens of thousands of peripheral joint injections under ultrasound guidance. Additionally, he has conducted thousands of exams using electrodiagnostic medicine, EMG, throughout his career. The EMG exam, when performed properly, can guide the clinician to give an accurate and thorough diagnosis, which leads to more effective and appropriate treatment options. Lastly, Dr. Komar has personally trained and instructed nearly a dozen physicians through each of their year-long intensive training programs, and all of them are successfully utilizing these skills in their own practices and clinics. Dr. Komar has received numerous awards as a physician. Patient's Choice honored him with the prestigious Compassionate Doctor certification, one of a select few physicians for both 2008 and 2011. Also, he earned the Phoenix Magazine's Top Doc for 2011, 2012, and 2014. Giving back to the community, he helped bring PM&R practitioners together by volunteering his time to serve as the educational chair for the Arizona Society of PM&R for 4 years, and then as president for another 2 years. In addition, he previously held the position of adjunct clinical assistant professor at Midwestern University from 2006 to 2016. In his free time, he enjoys volunteering for the Boy Scouts of America, which his sons are active members of. Gentlemen, it's an honor to have two of the finest MDs I know in my house today to talk to Ahwatukee. And it's an honor you're on the show, but I thought the most amazing, two things I want to talk in. You talk about men being different than women. So many, when I got out of school 30 years ago, they said TMJ and migraines was a woman's deal, and men didn't have it. And that ran them off the research the wrong way in the trail because they were thinking, well, it must be estrogen or progesterone, whatever. And then epidemiologists over the years figured out, no, they have an equal rate. It's just men never go seek help. So when, even in dental consultants, let's say that your dental practice isn't doing well. Almost all the clients are women because the men's like, I don't need help. I'll just, I'll wait till the walls come down. So what I want to do is, you're talking to Ahwatukee. What are you seeing in Ahwatukee? Who's coming to you? What are you fixing? Because someone listening might think, that's what I have. So who's coming into your practice at Ahwatukee?
Well, you're the men's health guy.
Well, I would say it's exactly as you just painted it. The men who have health issues, but they just maybe don't think it's like a worthiness thing, or they just don't feel like they have the time. And I think until it interrupts like their workplace or some other activity that they love to do, like if they're running and suddenly now they can't run as vigorous as they used to, then they finally seek help. And it's usually the wives that come with them too that encourage them to finally get some treatment and realize they don't have to just suffer.
I saw a piece of research by a medical economist from Harvard, and she studied like a gazillion appointments ever made at the doctor for like a decade. It was like 91% of the appointments are made by women. Men live 5 years shorter than women, and that's a big part of it. So, I mean, how many times at your family reunion growing up did your grandpa show you a lump or a bump, and he's like, yeah, it's been there like 5 years. It's like, how many years does it have to be there, Grandpa, before someone looks at that thing and biopsies it? So, yeah. Men are usually their own worst enemy, aren't they?
It's very true. Same with my entire family. Men in my family never go to the doctors.
Right.
You can't. It was pulling teeth getting my dad to come in to finally see me when he had knee pain when he came to visit, and he just didn't want to bother me. They just always kind of put everybody else before them.
Well, that's an interesting way to look at it. They put everything before them. So what are your hours? Because the first thing you said is, they're too busy at work. I read a study from the Federal Reserve that did a huge study that said 1/3 of Americans cannot go to the doctor or the dentist Monday through Friday, 8 to 5. So if you're not open before 8 or after 5 or on a Saturday, basically 1 out of 3 Americans have to. That's why the emergency rooms are used so much. 8% of America's emergency room visits are tooth-related, and it's simply that's the major reason.
Right.
I couldn't. So what are your guys' hours?
So to address those types of issues, we have a clinic open from 7 a.m. till 7 p.m.
Wow.
Monday through Saturday, and
wow.
that's
If I told
across the board.
If I told my staff that we're going to open 7 to 7 Monday through Saturday, you'd see me hung in my tree in my front yard.
Yeah.
On your way back, can you stop in my office and explain them the new hours?
And in terms of, especially like the Saturday clinic, it's just nonstop how many people are appreciative that you're there on Saturday so they do not have to miss work, that they can come in, not have to deal with traffic, not have to deal with all the stuff that you would have to deal with during a normal work day to try to coordinate things in order to get over to the doctor's office before they close at 3:30.
One time I met at your office for a bike ride. We were doing one of our
Right when we first opened?
one of our friends that we bike with got ran. It was a memorial bike ride for one of our friends who was ran over here in Ahwatukee, and I got there and I couldn't believe you were already open. I thought, you guys are open? I mean, I couldn't believe it. But yeah, so 7 to 7 Monday through Saturday.
Yeah, obviously we're not, both of us aren't there the entire time, but we can
Right.
stagger shifts between the medical department where someone's going to be covering for most of those hours. There's a few hours that we're not there as the medical staff between 7 a and 7 p.m.
So
But
12 times 7 is 84, and there's only 168 hours in a week, so 168 minus 84. God. Oh, so what am I? It's half and half. So
if
50% of the time you're open. That is amazing.
for the most part, slightly under that. For chiropractic, we definitely have someone there from 7 a.m. till 7 p.m. Monday through Saturday. For the medical department, the only time we don't have someone there that's seeing people is Friday afternoons and Saturday afternoons. So just on the morning times on those days. But everything else is 7 a.m. till 7 p.m.
So, what are you guys treating? Why do people go see you two?
There's so many variety of things that we can end up treating, basically encompassing the entire body. So musculoskeletal injuries, sports injuries, shoulder pain, knee pain, any type of muscle, joint, ligament, anything in the body we can address from just a pure pain perspective, a function perspective, someone that's like weak, someone that's not able to perform something like running or golfing or bowling like they used to just because of a certain shoulder issue or a knee issue. We can address all those types of components.
Do you think a lot of men don't want to see you because they don't want bad news? They don't want to hear that you need, their knees have been bothering them for years. They don't want to find out that you say you need a knee replacement. Or, they just, do you find that? Or their shoulder always hurts, and they say, I know what you're going to say. You're going to say, I need a shoulder surgery, and I'd rather just tolerate an arm I can't put all the way over my head.
Yeah, I just think it's more I think a lot of guys are just stubborn. They just want to put up with it because they don't think that there's any great options out there to make their pain better. They think that they're just going to have to deal with it, or they're going to have to go through an extensive procedure that they don't really want to have to recover from.
Yeah, that, and I think I think men in general. I don't know if it's a worthiness thing again, if it's really like not being seen as weak, but there really is a lot of things that can be done that don't involve surgery. I think that's where our field gets overshadowed because a lot of people think of a sports injury, they think they should go see an orthopedic surgeon right off the bat. And 90% of the time, they don't need surgery. They need all the other kind of treatments up to surgery, and that's really what we specialize in.
Well, I remember this was a long time ago, because I know you have chiropractors that work in your office. How many chiropractors do you have?
We have 4 total chiropractors. So we have 2 chiropractors that work Monday, Wednesday, Friday, and another set of 2 that work Tuesday, Thursday, Saturday.
So
we have 2 chiropractors there at all times.
So you have 4 total chiropractors and 2 MDs.
2 NDs. We have a nurse practitioner that kind of fills in the gaps, kind of sees her own patient population, as well as a lot of our overflow when people are trying to work in if they had something just come up that they need to be seen, as well as primary care.
Well, regarding the chiropractor issue, I remember it was like 30 years. I was at as actually Senator McCain and his wife Cindy were talking to some group. I don't know if it was where it was, the Kiwanis Club, because they had started that Arizona Voluntary Medical Health Team. And we went to Guadalupe, went to Indian reservations, things like that. But he was saying that they got chiropractors to cover care because it used to be if you had lower back pain, you'd have to go see an orthopedic surgeon. And he said, well, if you send someone to a surgeon, if your only tool is a hammer, everything looks like a nail. And it was always a $50,000 bill in a surgery. Right. And so we got chiropractors covered because we found out the bill would only be 10 cents as percent much. Most of them didn't need surgery. And if you did 5-year follow-ups usually minimally invasive conservative treatment has higher customer satisfaction at 5 years than invasive surgery.
Exactly. And that's what I love about AZ Spine Disc and Sports, like the whole value package at one building of chiropractor, physical therapy, train the person, massage therapy, acupuncture therapy, medical. So it's the whole kit and caboodle under one roof to be really rehabilitate the person, get them back to their sport, get them back to their activity, maximize their function. Really.
The other thing I've noticed over 30 years is a lot of really innocent people, doctors, dentists, bankers, lawyers, went in and had a knee replacement and then couldn't get off the pain pills. Mm-hmm. And a lot of them that had invasive surgeries actually got an addiction to the opiates. So that's another reason minimally invasive is.
Exactly.
Yeah. So again, I think you guys are shy, but talk about cases. Like talk about some man you thought you were gonna need a knee replacement. Or talk about cases that you. What treatments are you doing? Why do people call your office? Why do they come in? And what are some range of services?
We treat such a wide variety of things. I would say that probably 50 to 60% of the cases that walk through the door are some type of neck pain, back pain. We see
from a sports-related injury,
or could
it be just chronic pain?
Be from an injury. It could just be from just wear and tear over the years, just normal routine aging. Some people's bodies break down more so than other people, and some people, when you have development of arthritis and other degeneration, they develop pain along with it. So, there's so many different varieties the way people can present. You can have two different people with the exact same looking MRI. One person's in severe pain and one person is completely functional and doesn't need any type of medical treatment whatsoever.
Well, I have to tell you, I'm a firm believer that a lot of pain is in the mind. Because as a dentist, I've given shots for 30 years. When you do missionary dentistry in third world, where they're barefoot, they live without running water, electricity, nobody flinches during pain. They're just stoic. They're just like, and every dentist, they're like, oh my God. And then you go to a really rich developed country like Ahwatukee, and they might be sleeved with a tattoo that was like 1 million injections, a clip through their eyebrow, a bar through their tongue, and they're like crawling all over, like, oh my God, I'm gonna get a shot. I'm like, well, did they numb up your tongue for that bar through your tongue? No. Who numbed up your eyebrow to clip? No. Did you get numb for 8 million shots on that sleeve? No. So a lot of pain's in the mind. Do you think a lot of that's psychological, or do you think a lot of it's
Not necessarily psychological. Pain perceptions is going to be different for everybody, and there's so many different variables that go along with the perception of pain. Stressors in life, stressful jobs, sleep issues, hormonal issues. There's a lot of things that help modulate the way that your brain perceives pain from the body. So some people can be very stoic when you look at like an MRI or an X-ray and you're expecting to walk into a room and have someone that can barely get up off a table and they're very functional. And there's the opposite's true. You can look at pictures and everything looks like it's fairly normal and the patient appears debilitated when you walk into the exam room. So not necessarily psychological in terms of something's like a disorder, but perception of pain has so many different variables that play a factor in how the mind works.
Well, you were an athlete. Whenever I've been lucky enough to get like really good seats at the Arizona, one time at the Arizona Cardinals game, I was like in the 6th row. And when they hiked that ball, it sounded like a car wreck. Mm-hmm. And you see guys like get hit and like flip over and land on their head, and they just jump up and run back. And I just like, every one of those tackles, I wouldn't have got up. Every one of them would have been a 911 ambulance call and start the IV of morphine. I couldn't believe the punishment they could accept. Yeah. But I want to go to you because you're in baseball, and you just said talk about the normal aging deal. Mm-hmm. If you're on the internet, social media, there's a lot of people saying, well, you can fight anti-aging like Barry Bonds, and instead of just using testosterone and human growth hormone to hit more home runs, Grandpa could be doing it at 70 years old to get more function. What do you have you heard of this anti-aging?
Like the cytogenics type, where you see like the gentlemen like their 70s and 80s that look like they're in better shape than kids in their 20s.
But what I do to look so much better, I'm serious. What I do is instead of telling people I'm 55, I tell them I'm 85, and they're like, "Damn, dude, you look
great."
good." And but you've heard of these hormone replacements, these anti-aging, and also some. You guys are in sports medicine. I read a deal that in the Ironman, I've only seen 2 studies from Ironman where they randomly went in and surveyed and tested, who would pee in a cup or whatever. 10% of them were using testosterone and human growth hormone. And then a lot of patients over the years have asked me, well, I found this Life Extension Institute in Palm Springs, and they give you daily testosterone cream and human growth hormone. Do you guys see people? Do people ask you about that, and what are your thoughts on it?
Well, I got into bioidentical hormone treatment, which
Yeah.
is more of optimizing hormones and not just testosterone, but looking at their thyroid, looking at their vitamin D levels. So it's the whole gamut. And really, it's going beyond just what the CDC is recommending for normal levels, but actually optimizing it in part for treating symptoms of being overtired, having low energy, low ability to kind of build muscle strength, low libido, but also for
Does
us,
low libido include ED, erectile dysfunction?
correct. But in our
'Cause
side,
I thought libido was like your desire.
that too.
So
it's
libido's
also
desire,
the desire and the function.
but the fun. Okay.
Yeah,
But-
and that's usually the last thing to go. So there's a lot of things that can fall to the wayside before that even happens. But optimizing hormones means optimizing health, not just in their current symptoms, but also helping prevent certain kind of diseases. My interest was also in, as we were talking already, we were talking about people getting hooked on medications and what medications, opioids, how it can drive our hormones down. So it can actually lead to depression and mood changes and decreased sleep and actually a higher pain tolerance. So optimizing hormone may in turn allow us to be able to get some of these folks off of their medicines, off of these opioids that they've just been dependent on and would like to come off of.
But if Grandpa, well, what would be the age when someone would be a candidate for bioidentical? Or I know humans are very diverse, but what is kind of the mean, the mode, the mu of when people start benefiting from that?
More likely men in their later 40s through their 60s. But there have been men in their 30s who have low testosterone levels too. And they can start to see the same kind of effects. And especially if they've been on for narcotic medicines for years, they're going to see kind of low testosterone that somebody in their 50s or 60s does.
Is it true that once, like I'm on one prescription med. I can't tell you because it'll be a HIPAA violation. Well, because I might sue myself. Can I only sue me, or can HIPAA sue me for telling me? So I'm on a thyroid, and I'm low thyroid, along with a sibling. And I've studied a lot because that's the only pill I'm on. And it's an autoimmune disease. They say it's a cluster. They say it runs in family trees, and it's associated with low thyroid, autoimmune eating thyroid, MS, celiac sprue, rheumatism, arthritis, and pretty much all of those are all splattered throughout our family tree. But on testosterone, is it like thyroid? Like I'll have to take thyroid every day for the rest of my life, and but if I started bioidentical testosterone, would my testicles say, "Oh, we don't need it anymore"? They atrophy, and then you have to be on it till the day you die?
Great question. And the answer is no. It really is, once you're off bioidentical hormones, your body goes right back to the way it was before we even started it. So it really is a trial. It's a sense of where are you before you start the trial, and then 4 or 5 months later when it wears off, it's a sense of where are you at that point. Was it worth it? Did it make a difference for you as far as your function, your lifestyle, if you felt better? So it really is a sense of just, is that something you would want to continue? And that's really on a trial basis. So no, there's no reason that you have to be on it for the rest of your life. And if once you come off of it, your body will resort right back to the way it was before you started.
Really? So I know I don't know why I'm asking this, but there was a famous governor who was a Republican in California. He used to be a bodybuilder and won Mr. Universe. We won't say Arnold's name, but I think when he was in office, but anyway, he had to have a heart surgery. And I never read it in a paper, but a lot of patients said, I wonder if he had to have that heart surgery because he was using steroids. Because steroids, there's three muscles. There's smooth muscle in your arteries, there's cardiac muscle, and then there's skeletal muscle. Do you think that was a hormone injury?
Well, I mean, the trouble with a lot of data that's out there is the heart issues came from before it was bioidentical.
Right.
It was synthetic horse type of serum type of thing. So these were injections. These were unfortunately not human identified type of hormones. So a lot of that bad data came out of that kind of treatment back then.
Same with female birth control. So many people associate female birth control with something, but it used to be female estrogen taken from horses.
Exactly.
So explain the difference explain what bioidentical is. Just someone listening that doesn't know what bioidentical means.
So bioidentical means it mimics what we have. It mimics who we are. So it's not from another animal, not from another product. It's identical to what we see as humans. So you're not making up something. You're filling in the gaps of what is.
Because that's how they used to bust them in the Olympics. Because if I took a bioidentical Homo sapien testosterone, how would you know it was fake? But they would take testosterone and they'd say, "Oh no, that's mine." I go, "No, it was dihydrotestosterone." And they go, "Homo sapiens don't make dihydrotestosterone, so are you a horse or or a human?" So explain to the viewers what symptoms would be a candidate for a bioidentical hormone replacement.
Someone who's just low energy, feeling like mid-afternoon, you're just always having either like brain fog, like it's hard to concentrate, it's hard to stay awake, you have decreased sleep, particularly if you're having symptoms of just like you go to work, you go to the gym, you're working out, but you're just not building up muscle, you're not able to lose that fat like you were when you were younger.
I got to tell you the story. I can't even tell you without getting verklempt. I had a patient. This is back in the day. This is before I ever even heard anything about it. But I had heard other dentists talking about this. He was an older man. He was like 70. He was in an accident, broke some legs and bones. He was in cast, but the whole time he was in cast, he was in a wheelchair. When they took out the cast, he was too weak to get out of a wheelchair. And a year later, he had big calluses on his elbows from being in the wheelchair. And he started to lose his smile, and he started to get grouchy and frustrated. And his wife said to me, "God, can you think of anything?" And I said, "Well, I've actually talked to like 5 other dentists, and they said, this is back in the 80s. I said, if you drive to Palm Springs, there's this guy, and he's doing blah blah blah." She said, "Well, it's worth a try because he's getting so grumpy. I'm gonna have to shoot him or take him to a vet or put him down or move out." She took him down there, and he started the daily testosterone, the human growth hormone, a bunch of vitamin supplements. It wasn't even 8 weeks, and he was doing push-ups. And everybody was just like, and she to this day, they're both still alive. They're both to this day, they're just like, that was the greatest gift you gave us, is something like that. So my other question is, we keep talking about testosterone, we're talking about men. What if grandmas out there listening to that do you do much of this bioidentical with grandma?
We do. We have a nurse practitioner in our office that does a lot more of the female patients. Difference between male and female, it's night and day, depending on what the needs are between the genders. So she is kind of our in-office expert on female hormone replacements, and Dr. Komar takes over a lot of the male replacement. And then
what would be the if you go to McDonald's, it's a hamburger, fry, and a Coke. You go to my office, it's a cleaning exam and a filling, right? What's like the number one thing you guys treat? 2, 3, 4. What's your hamburger, fry, and a Coke? What are most people coming in for?
The office in general, probably
Yeah.
chiropractic. Our chiropractic is what has been around the longest. My wife is the owner of AZ Spine Disc and Sport.
You work for your wife?
I work for my wife. She actually hired me.
Are you in depression or treatment, or do you feel emancipated?
It's actually a great situation because I just get to focus on being a doctor, and she actually has the headache of actually running the entire office.
And then when she comes home, you say, now I'm the owner. I'm the boss at home.
No, she runs there too.
She runs work at home?
Yeah.
Oh my gosh.
I used to be very self-sufficient. I could pay my own bills, everything. I haven't paid a bill in 3 years. She does absolutely everything for me. So I can just be a doctor. When I go home, then, I don't have to worry about anything else. She's been fantastic.
So the main thing is chiropractic. Because
Yep.
you said earlier there's 4 chiropractors. There's 2.
So she graduated in 2004. She moved to Arizona. She started a chiropractic business, and it was just chiropractic all the way up until 2014. I came to Arizona in 2013, where I got trained at Southwest Spine and Sports. Dr. Komar was one of the doctors that trained me while I was there. Once I finished my 1-year training program, with discussion with my wife, was why don't we combine forces? Because every patient that she's treating that needs some type of medical treatment for pain or whatever, she was referring to me. So people that I was seeing, I was referring to her. So it just made sense that we would combine and kind of work together as kind of a team. In addition, we added on the physical therapy, the acupuncture, the massage therapy. Well, massage therapy's always kind of been in her office too. It was massage and chiropractic, but basically all the other pieces to truly form a multidisciplinary practice. But chiro has been around the longest. It's the largest patient base that we've had. So she has an enormous load of patients that she treats every single day.
So number one, what's the minute details of why I would want to see a massage therapist versus a physical therapist versus a chiropractor?
And
it sounds like if they can't get the pain to go away, then they see you guys.
Yeah, I mean,
is that pretty much it? But why would I see a massage therapist versus a physical therapist versus a chiropractor?
Yeah, I mean, there's a lot of overlap too with what goes on within our office. A lot of our chiropractors, physical therapists do a lot of the same type of treatments. They have their own different niches that basically allow them to be separate, such as, I mean, the chiropractors are doing more manual adjustments, which physical therapists for the most part do not do. Our physical therapists are doing things like dry needling and other types of treatments that our chiropractors don't do. So,
what's dry needling?
So,
I take it it's a form of crochet.
Very, very close. It's like
I grew up with 5 sisters. I can embroidery, knit, and crochet. When you grow up without a brother, you have 5 sisters. I know it doesn't sound very manly, but I'm pretty good at all 3 of those.
You want to talk about dry needling a little bit?
Dry needling is basically targeting certain muscles, where you get these tremendous knots in a muscle. So it's a way of applying a small pin to each of these muscles for just a moment, just allow that muscle to relax while they're in therapy so that they can get a better stretch, they can get a better relaxation of that muscle, and then allows them to participate more fully in the physical therapy, which is really training them how to exercise at home and become more functional outside.
And this patient base what is the age range, male, female? I mean, who's most likely to need these? Is this...
The most common patient in our office is the 40, 50-year-old lady. That's just across the board everywhere. They're the ones that are going to seek out the most medical treatment.
Yeah, and a lot, by the way, a lot of when you ever hear a man say, women drivers, they can't drive. Well, you can just show them the data of the insurance policies and say, well, I'm pretty sure State Farm thinks a 16-year-old male drives a hell of twice as worse as a 16-year-old girl. And I've heard many women say that it's not fair on insurance pricing because their premiums are also higher. But the fact of the matter is, men don't raise their hand, men don't seek help, they die 5 years earlier, they're just cheaper to insure. So you said across the board.
I mean, that's just a general. I think that's going to always be kind of more true. But I mean, being in Ahwatukee, it's definitely a younger part of town. We definitely have compared. I mean, we have a lot more patients probably in their 40s, where I think a lot of other pain practices are dealing more in the 50s, 60s.
I have a really weird perception of Ahwatukee because I'm at 48th and Elliott, and I got there 30 years ago. It was a retirement community. And 48th Street, when I got to Ray Road, it was all cotton fields. But I noticed a lot of people down in Ray Road or in the foothills think it's a younger population. But Ahwatukee's got a significant retirement community.
It does. There's a lot of young professionals as well as retirees that live in Ahwatukee. We got a pretty good diverse age range
Yeah.
across the board.
So it's mostly women, and why do they need to see a chiropractor? Was it a...
So usually if people come in and they don't know what they need, usually our front desk staff are going to direct them either to an evaluation with the medical department with me or Dr. Komar, or with one of our chiropractors. Those are the medical professionals that tend to start from the very beginning, history, physical, come up with a full treatment plan. A lot of my treatment plans, and Dr. Komar, I'm sure, is the same, involves a lot of therapy. We refer a lot of people out for physical therapy, chiropractic therapy, massage therapy, depending on the needs of the patient.
So if you watch the media and the news, it seems like the number one thing that like movies and television talk about is, yeah, I need to go get a cortisone shot. Mm. Is a cortisone shot still a significant treatment, or is that old school?
No, we still use steroid shots quite a bit, as a way to symptomatically improve pain and inflammation, with the end goal hopefully being that they are able to strengthen and improve the function so that they're not coming back in every 3-4 months hoping to get another steroid injection so they can keep going.
So chiropractic care is the most 40 to 55-year-old women.
We got a wide variety of super elite athletes, a lot of triathletes in the Ahwatukee area.
There's a ton of Ironman athletes. I mean,
our chiropractors really specialize in doing a lot of muscle work, active release technique, a lot of things that can help keep very elite level weekend warrior type athletes doing what they want to do, But we also just treat a lot of people that just work a 9 to 5, and doing therapy can keep them active, keep them pain levels under control, keep them being able to function and be happy with their daily life.
There are so many people in Ahwatukee that if they do any marathon from here to Boston, will make top 5 in their age group.
Yeah.
I mean, it's common to meet someone like, not only has done an Ironman, has done 12 of them, that runs the Phoenix Marathon and places 3rd in her age group. I mean, there is a lot of athletes out here.
Driving to work on Saturday morning, it's like you see more cyclists and runners out than you see cars every single morning.
Yeah.
So let's talk about that. Weekend warriors. Let's start throwing sports under a bus. Which one causes the most injuries? Which one is safest?
In terms of sports in general?
The weekend warriors in sports. Who hurts themselves? Which sport hurts themselves the most?
Ooh. I mean, we see a lot of injuries coming from more of the endurance athlete, probably just from...
And explain what an endurance athlete is.
So we have a big Ironman triathlete, people that like to go
a long
time for running, all those kind of activities.
So you're going to get more hurt in a marathon than a 5K.
Your body's going to have a tendency to break down a lot more by training up for a marathon than just training for like a 5K.
Yeah.
That's a very hard thing to do.
Endurance sports cause the most injuries.
Now, I mean, we just see like a lot of the acute injuries, the injuries that just happen, can happen with almost any type of athletic sport.
But would an acute injury be more likely now to be from a car wreck or a sport?
Probably pretty equal. I mean, we see a lot of car accidents. We see a lot of work injuries, but we also see just a lot of people that went out and played pickleball and just hurt themselves that weekend.
Played pickleball? Mm-hmm. I've never heard of pickleball. I'm pretty sure that's
you've been in Ahwatukee for how long?
30 years.
Holy cow!
So I mean, I just learned what pickleball is when I got here.
Pickles? I could do that.
No, it's named after the guy who invented the game. He named it after his dog named Pickle, and so it's actually, you're not throwing a pickle. I thought the same thing too. I'm like, is that what they're doing? It's actually a really small version of tennis, so the court is a lot smaller. They don't have to run long distances, and it's either done in like pairs or singles. So they have the same kind of like reaction time and kind of rackets on a court, but it's a much smaller version, so it's a lot less chance of injury. And retirement communities love it because it really activates the brain. It's fun playtime, and yet it's not as physically demanding as tennis is. So it's less chance of injury. But man, some people we have patients who are...
So pickleball is the most injury?
Not necessarily the most injuries.
No,
There's just a
after
huge
endurance.
pickleball community that lives in
All I can
Ahwatukee.
remember
So
about pickles is the first time I was at my grandma's house making her watching pickles. I can still remember it was like it was yesterday. And my sisters were all trying to learn how to do it. And I was just sitting there thinking, who was the first idiot that decided to soak a cucumber in vinegar in a barrel for 3 months?
Yeah, right.
I mean, how did someone think of that? And that must have been the weirdest guy that ever lived. Hey, here's a cucumber. Let's soak it in grotesque vinegar for half a year. But so endurance sports, I would have guessed that, because you always think, well, if I go to the gym and I lift too much weight, I'm going to hurt something. Where would weightlifting be on this?
I mean, we see our fair share of like weightlifters, anywhere from people that look like that's all they do, and they're in the gym like 8 hours a day, to the athlete that's going to the gym for an hour 3 times a week. You know,
Equal amount of injury.
you know, it's hard to say if it's an equal amount of injury. It's all depend on like what ends up coming through our doors. But I mean, we get a wide variety of different type of athletic.
So
injuries.
here's a brain teaser for you. If someone out there watching us saying, I'm going to get a bike, based on injuries, would you say street bike right on the streets? Or would you say mountain bike and go run into a saguaro cactus? Would you rather be hit by a car or a cactus?
It's really more your passion. What are you passionate about? Do you really want to exercise for the sake of exercising? You know, you can always do that at gym, but if you really want to get out and enjoy this beautiful Arizona weather now as it's getting cool again, it's the passion. You want to take that risk on the mountains but enjoy that outdoor feel. Yeah, but of course every sport comes with any chance of injury.
Can I tell you my mountain biking trauma?
Uh-oh.
I've never wrecked on a mountain bike, but one time I was right over there, and one of my buddies I noticed was way down the hill over there, and I'm standing out there yelling his name, and he finally looked up at me and he waved, and he went off the path and flipped his bike, and I thought, why was I yelling his name? He was doing fine until I yelled out his name. And then one time I was on the Beeline, same exact thing, and the guy on the other side was going, hey, and it was with a group from Ahwatukee, and the guy looked up, and when he looked up, his bike went into a rut and he flipped it, but the whole crash was because someone on the other side of Pecos was yelling his name.
Yeah. You mentioned earlier about cortisone injections, and I think that's what we also want to mention is that we're excited about regenerative medicine. It's something you mentioned. Is there something newer, because we still use steroid and it still applies to what we do in medicine?
You talking about your platelet-rich plasma?
Exactly. It's a way of using the body's own natural ability to heal itself. So taking their own blood from that person, spinning it down selectively so we just pull out the platelets that have a lot of, the plasma that has a whole lot of platelets in it. That helps start maintain wound healing. So we can use that to treat a tendon injury or a joint injury or a muscle injury rather than steroids. Steroids have the ability to take away inflammation and it helps reduce pain, but it's something you don't want to use repetitively on a soft tissue because it can help actually degenerate that tissue.
You know, when I saw that was so interesting when I saw that, because 30 years ago when we started placing dental implants, we just drill a hole and place a titanium implant.
Right.
And then a decade or 15 years later, that's what dentistry started doing. They started, well, let's draw blood, put it in the centrifuge, spin it down, and pack that around the implant.
Yeah.
And it's just a better surgery. And we probably don't even know, at this point in time, we probably won't know for 1,000 years all the things that's in there and all the things it's doing.
And it took musculoskeletal at least a decade after dentists were already doing this kind of work to apply it to all the other joints and tissues in the body and really make a huge difference for that person.
I notice some patients, they come in and they confuse, they get on the internet, remember, I went to 9 years of college, but they Googled root canal for 15 minutes. We're pretty even. They'll say, well, are you going to use stem cells around it? So a lot of people confuse platelets, stem cells.
Sure.
What would you say?
Stem cells, which we think is like the next step up, is harvesting it from the person's own bone marrow and spinning that down and giving. And there you're using cells that have the ability to regenerate into any kind of tissue. And if you put it next to injured tissue, the hope is that it's going to replicate and replace, at least on a microscopic level, the tissue. And so, as a good example, one of our patients, we actually use the amniotic tissue, which is a lot of growth factors. And he's a man who has a lot of duties at work to do plumbing. He has to do a lot of bending, and he had a meniscal tear in the knee that just hobbled him. He couldn't do the work he was doing. He was getting depressed about the fact that he couldn't do this kind of work. And he came in and we gave him all the options, and he really wanted to explore the amnio option. And that was taking amniotic, not embryonic. So this is not a ethical issue. This is embryonic tissue that has a lot of growth factors, and put that into his knee. Now, 6 months later, he is fully functional. He can get all the things he wants to get done. He avoided surgery. He did really well with physical therapy, but he doesn't have to have repetitive steroid shots. He had the one amnio shot, and 6 months later, he's still doing great.
Yeah, if I ever need any of that embryonic stuff, I don't have to worry because now I have grandchildren. Just invite them all over for a birthday party and start drawing their blood. So one of the things that is very depressing to a human being is when they're going through pain. And it seems like the most frustrating people you meet at Safeway and Starbucks and the dental office are people just dealing with chronic pain. You guys do a lot of pain stuff.
We do.
A lot of people just think they have to deal with it. They say, well, I got pain pills, but I don't like to take them. If I take these, a lot of the pain pills they'll say, well, if I take Oxycontin or Percocet or Percodan, they say, I can't have bowel movements. I get agitated and angry. If I switch to the aspirin, my stomach's raw.
Mm-hmm.
But it does really wear down on their happiness.
It does, and I think that's where we can help out as an MD, is really evaluating why the pain is there in the first place. And a lot of times people get started on pain medicines or other treatments, and it's not really, it's for like back pain, but they haven't been through an evaluation, they haven't been through other treatments. And sometimes like the injections that we can do are very specific about where we put the injection. And for example, I have a guy who had a lot of back pain, had previous surgeries. He was suddenly going from bad to worse, getting dependent on his narcotic medicine. And it wasn't until we got down to the nitty-gritty and actually got the right injection at the right place, he was able to come off all of his narcotics. He's a whole lot better. He's got a lot more hope. Because before it was like just desperation, like why is it getting worse? And working together and just going down a very specific path, trying to figure out where the pain came from, allows us to then fine-tune his treatment. And he's getting a whole lot better because of it.
And there's a lot of people that have been on narcotic-type medications for decades, and they're scared to death to try to wean off of these medications because they know what it's like living with pain, and they don't want that pain to ever come back. Which, one of the nice things about our office is we can offer so many different types of treatment to help control pain, to improve function, with the end goal hopefully being able to wean off a lot of these medications so that they don't have to become reliant on a pill in order to get through their daily grind.
One of the there's incredibly changing trends that I've noticed in 55 years of life. Like when I was in high school, if you got caught with beer or whiskey, they'd just take it away from you, or get a spanking. But if you were caught with weed, you were a criminal. That was like, wow, you're out there. Now marijuana is sold legally at 48th and Elliott in a medical marijuana dispensary. Another change, and I didn't say that, but 30 years ago, it seemed like you went to the doctor and they'd only see you like 7 minutes. Well, you got high blood pressure, here, take this pill. You got high cholesterol, take this statin pill. Oh, you're in pain, take this pill. And it's like a visit to the doctor, and if you said, I can't sleep, oh, take Ambien. Well, I'm kind of depressed. Well, here, take that. It's just like, you just tell them something and they give you a pill, which seemed like it wasn't very much different than 15,000 years ago. You go to a witch doctor and he only did two things. He either made some lotion and potion or cut something off. And then 10,000 years later, the surgeon's like, well, here's a lotion and potion, or I could surgery and fuse your spine or cut something off. But now, 30 years after my house opened, the millennials they're more holistic. And I hear people, you tell a millennial you got high blood pressure, they're first going with, well, how could I treat this naturally? Mm-hmm. Well, maybe you should exercise, lose weight, stop eating sodium. You say, my cholesterol is high. But it seems like the generation's going from just, okay, medicine man, give me a lotion, a potion, a pill from Walgreens and cut something off, to now like, wait, I got questions for you. I Googled this for 20 minutes. So it seems like it's getting. But if you tell, like dentists my age in Ahwatukee, if someone said, "Well, are you a holistic dentist?" You'd say, "No, I'm not a quack." You know, well, do you do alternative dentistry? No, I'm not a quack. But it's the word thing. So holistic alternative has a weird cuckoo thing with senior citizens. But what the millennials are saying loud and clear is, I don't like the U.S. healthcare system. We have 5% of the people on the planet. We have 232 million people out of 7.5 billion, and you eat half the prescription pills on the planet. And they're saying, are you sensing that?
I mean, one of the biggest issues with just medical training is that probably a third of our in-classroom training was on pharmaceuticals and pharmacology.
A third.
Probably, maybe not quite that much, but probably the biggest chunk of any education that you get before you hit the clinical rotations is pharmacology. And I think a lot of medication has been to write a prescription, because people come in with a complaint. The quickest way to get them out of the door is to hand them a prescription. And
Right.
a lot of patients come in and are expecting that prescription because in their mind, they go to the doctor, they think, I'm going to take this pill, it's going to fix whatever I have.
And that's why emergency room doctors give penicillin for viruses, because
Exactly.
people are like, well, you're not going to give her antibiotics? And it's like, okay, it's a virus. But I always like to, but I've asked you, if you had high blood pressure, would you take a prescription, or would you first try to change your lifestyle? If you had high cholesterol, would you just take a statin, or would you change your behavior?
I think-
Or how would you analyze that?
Modifying behavior and doing the things that are non-pharmacological are better for your long-term health. And I just think you're cutting out side effects, different advantages to being able to get out and to conservatively, without medications, control medical problems. Besides changing diet, changing exercise routines, just be getting up and walking in the morning can solve so many different health issues that a lot of people rely on by taking a statin.
Right. So do you evaluate people's prescription health history and sit there and try to talk about, because you some people, like, they'll be on a high blood pressure pill and a statin, and they've been on them 10 years, and then you see articles in newspapers that say, on a statin, the benefit kind of goes away after 4 or 5 years.
And that's one of the reasons why we look at bioidentical hormones. That's a preventative way to treat, the health issues and the cholesterol, and maybe there's a way we can get them off of those medicines as well. And that's why we have our primary care folks in our practice too, to kind of evaluate that.
So if a man called you up, and I'm asking about a man because I'm a selfish person, because I'm a man. If a man called you up and he had you want to know about bioidentical testosterone, you do blood work, and then
Yes.
and like just say, for instance, the guy was like, say, 55, to make it totally selfish. What would you want that testosterone at?
Ideally, the optimized is going to be somewhere between 900 and 1100 for
900 to 11. You got my curiosity. Can I give you blood in my coffee cup and take it back to work? They're on their lunch break. How cool is that? That on their lunch break of a busy day, you've been here 55 minutes, on a lunch break on a busy day in Ahwatukee, they came to my house just to talk to you for free. No one's ever paid to get on the show. I don't pay anybody to get on the show. But I just think that's so cool. And my pet peeve is with men, because I have an emergency room physician friend that I went to school with, and he's in another place, and he was telling me that, he had this patient come in, and he died. When he got to the emergency room, he only lived like 4 more hours, but he had black water diarrhea. And he said to him, how long have you had that? And he goes, about a year. And he had complete, and it's like, why would you have black diarrhea for a year before you raise your damn hand? Why? And erectile dysfunction. I mean, there's people that get divorced, and it's like, well, did you ever tell anyone that you no longer have any interest in your spouse? And if you did, it didn't work? I mean, did you ever think that maybe women always raise their hand, even directions? I remember as a little kid, we drove from Wichita, Kansas to Disneyland in a station wagon. I mind you, with no seatbelts, all the deals were down, and me and my five sisters played Monopoly from Wichita. We're all sitting around there. Dad's barreling down the highway, and every time he got lost, I mean, Mom and 6 kids would be begging him, well, just go to a gas station and ask. I don't need directions. And it was just like totally emancipating his manhood if he had to ask where the turn was to Anaheim. I mean, like, and a woman just like, well, wouldn't it just be easiest to ask? So, men, raise your hand if you got a lump or a bump. Quit showing your Uncle Eddie this bump you've had for 5 years and start showing it to maybe someone who works on bumps, especially on Homo sapiens.
I think one of the biggest reasons why a lot of the men in our office are turning to the bioidentical hormones is while they're waiting for us to come into the room for that 5 to 10 minutes after our medical staff puts them in the room, we have some pamphlets, some information in there about the hormones that they just pick up, they start reading, and they see the list of symptoms, and it starts clicking with them that I have like 80% of this list. Then they started asking the questions, like they were coming in to address something like with their knee pain, and then they're like, well, okay, yeah, I can deal with the knee. Tell me about this, because I have all the symptoms in this brochure. Can this help me get rid of all of these complaints that I've been dealing with for like 5 years that I didn't even think were an issue until I just actually read all this stuff and draw some simple blood work, come back with the lab values, talk about different ways we can optimize all their hormone levels. And a lot of them are just almost upset with themselves that they did not do something earlier because they've been dealing with issues for so long that they could have been easily preventable and treated.
And tell me if I'm a cynical bastard or if this is right. When you talk about, say, erectile dysfunction, you said about a 30-year class is pharmacology. Mm-hmm. When you say erectile dysfunction to the American people, they say, well, Viagra or Cialis. They don't say bioidentical hormone because there's no patent on a bioidentical hormone and there's no money in it. Mm-hmm. So no one's going to run commercials and say, hey, go buy this really low-cost thing with no profit at your doctor. So I have to ask you, what is better for erectile dysfunction? Bioidentical hormones or all the Viagra, Cialis commercials you see during the news?
That's a loaded question, but yeah, I think it's going to be the bioidentical hormones because you're replacing what nature is decreased.
So why don't you see advertisements for bioidentical hormones?
Like you just said. I mean, I think that's a part of...
Money's the answer. What's the question? There's no patents.
There's no TV advertisement. There's no...
Right.
Yeah.
You don't have two people sitting in a tub.
And do you have this in your industry? I know you're in your lunch. It's 59 minutes. Final question. And does it pollute your industry? Like, you don't have to go to very many dental conventions, and how many of them are sponsored by someone selling you something?
Right.
What percent of your medical MD conventions and lectures are sponsored by people selling something?
It's a lot different probably from when I was in training than, even just by less than 10 years.
Yeah, it's changed, but it's still quite a bit of pharmaceutical industry that supports a lot of our education. Yeah.
So I know in your fast food society, I mean, when I was little, true story, when I was born, America, you couldn't get a hamburger, fry, and a Coke in under an hour. Every hamburger place you went to, you give your order, you'd walk in there, they'd seat you. Then take your and then they take your drink order. Then they go get your drinks, bring your drinks back. Well, what do you want to eat? Oh, hamburger and French fries. Then they go give it to the cook, and it was an hour process. Now you just dive through McDonald's, and if there's 2 cars ahead of you, you're mad and hitting the horn like, my God, I don't have a minute and a half. And I think that's the way what a lot of Americans do with healthcare. They say, well, I mean, I have had people just point blank and say, well, can't you just give me a pill? Well, I can't give you a pill. It's either a root canal or an extraction. And it's like this fast food mentality, pharmaceutical. I think the rabbit and the hare, I think that sometimes just doing things slow and naturally and changing diet and exercise and starting your walk in the morning and all that kind of stuff. Mm-hmm. But gentlemen, I cannot believe I got 2 of Ahwatukee's finest MDs to give up their lunch hour to come over to my house and talk to an invisible camera. But I've been big fans of yours for a long time. Actually, been a bigger fan of your wife longer than you. I knew her before you. And Tell her I'm still mad at her that she didn't marry me instead of you. I mean, she
I'll
knew
let
me
her know.
first. But thank you so much for coming on the show. Oh, by the way, how do they get a hold of you? Your website is azspineandsport.com. azspineandsport.com. What are they going to find if they go on your website, azspineandsport.com?
It's been a little while since I actually logged in myself to look because it's always changing. We have a lot of information about just a bunch of different conditions that can cause pain between the neck, the back, the body. We have just an overview of pretty much all the different types of treatments that you can get in our office. I just really just think that the take-home point from what you're going to get out of our office that you're not going to get really anywhere else is we are definitely not a cookie-cutter organization. People don't come in and they don't get the same treatment. Everybody, a treatment plan is tailored for every single person that comes in because no two people are the same.
And these guys are shy and humble, trust me. They're shy, but they're Ahwatukee Best of 2016 Ahwatukee News Phil's first place in 2016, 2011, 2013, 2014, 2015, voted Best Chiropractor and Best Medical Specialist 2015. I mean, you guys are legends. And I'll tell you one thing about your wife. No one ever says, oh, you should go see Angie. It's always, she doesn't have fans. She has raving fans. Oh, my God, you got to see Angie. You know, the first person that referred me to your wife texted me her card on her iPhone. And then it was a little while later, I heard the referral again, and then that complete stranger at Lifetimes, she had Angie's number. You know, it's like, I've seen like 5 people, and I got to ask myself, how many of your doctors how many of your doctors do you have in your iPhone? I mean, she's a raving fan. I've never seen anybody just say, you know, check it, Angie. She's okay. It's like, oh my God, you got to see Angie, and here's her number. So
And those Best of Ahwatukee things, I mean, that's all patient voting. Like we have no influence on any of that in terms of we can't pay money, we can't do anything to become like the Best of Ahwatukee. We just have
actually, because what I did is I went to your website and I photoshopped them and just put them on mine.
Oh, that's perfect.
So you don't need this patient voting. You just need Photoshop, and that's the best way to cure a patient. And if their X-ray looks really, really bad, you just Photoshop it. It's a lot easier than treatment. Just Photoshop them. Gentlemen, thank you so much for giving up your lunch break to talk to my homies in Ahwatukee. You guys are
Appreciate it. Thank you very much for having us.
Thank you so much.